Okay, I'm in my 40s and I'm getting my 2 bottom wisdom teeth out and I'm terrified. And I'm getting it done like at a hospital dental area. But I'm gonna be awake the entire time. And I kind of wanted to document my experience even though I'm not a vlogger or show my face. So this is me terrified, walking down the hallway to the dental place where a resident, and it's the beginning of July, who probably never did it before, is about to do it. Yay. No, I'm so scared. I am in my 40s and I am just getting these out now. Why? Because they never bothered me and no one ever told me I had to. Now one of my bottom wisdom teeth is cracked. This is so nerve-wracking. I'm gonna be fully awake. 7th floor. Okay, I didn't say anything here. I just did like a little clip of the waiting room, but I was terrified. This is just me here waiting. They already called the other people back. I was the only one, so I knew I was next, and the waiting was almost worse. Okay, so I'm in here waiting. The nurse brought me back, and she told me there's a 1st and 2nd year resident. I asked if I could see the 2nd year resident. She said I could not make any requests. Okay, I just saw the dentist. He's really nice, but why did he put foil up here? Okay, so I never figured out why he put the foil there. Maybe for leftovers for his lunch later. I don't know. That was kind of weird. But anyways, I'm done. You can see this is my disgusting wisdom tooth here. I wish I could have recorded it, but I was by myself in the office and then the oral surgeon, so there was no way I could have recorded it. But where do I even begin? So knowing that I was nervous, I already told him at the beginning, like, I'm going to ask you a million questions. I did. He answered all of them genuinely. He was genuinely nice and he answered my questions thoroughly. And just by doing that, it really made me feel at ease. So I was like, okay, at the point that he was like ready to pull my tooth out. So anyways, the worst part, because he put the numbing, you know, needle in. That needle always feels like it goes like through your face. I feel like that was the worst part because of course, yes, that hurt. But yeah, it was okay. After he did all the numbing, he did like a test feel, and I mostly didn't feel anything but pressure, but I did feel like one little spot, and he's like, okay, we're going to make sure that takes full effect. He left the office to help the 1st year resident, and he was gone for like, I don't know, 15 minutes. So by the time he came back, everything was completely numb. And to pull one tooth, I mean, it literally was so quick. If I had to guess, I would say it took like 30 seconds for like the whole thing. So like the longest part is waiting to go into the office. And then once you're sitting in the chair, then, you know, the nurse comes in, takes your blood pressure, then leaves, and then you wait, and then they get called away and you wait for the numbing. And that was like the longest part. The whole thing took, I would say, about an hour and a half from like when I first got into the office to the time I was leaving. But the pulling of the tooth took 30 seconds, I would say. So yeah, the worst part besides the needle was the sounds, right? Because I didn't feel absolutely anything. I did hear like the sounds, you know, and of course you feel pressure, but you don't feel anything. And if somebody is telling you you need your wisdom teeth out, so, you know, like I said, I'm in my 40s, like, I don't need them out. They don't bother me. Well, then the one was cracked and then it kind of bothered me, but then it was okay. Yeah. So I know it just changed screens, but you can see that was the first one that was bothering me. You can see it was all black and dark. You couldn't even see that in my mouth because it was like half under the skin and half exposed. The dentist never even told me it looked like that. My regular dentist I see every 6 months for cleanings. So they can be decayed and, oh, just so bad. And they might not necessarily be bothering you, but there could be something going on that you don't see. So I'm glad I got them out, even though I was so nervous. Yeah, and I do have to pass this wisdom along. My regular dentist always told me, you don't want to wait until you're in pain, because usually it takes months to get in to see an oral surgeon. You usually need a consultation, especially if you're not paying for it out of pocket, which of course I could never afford. I had to use my insurance. You are going to have to probably wait, and you don't want to wait till you're in pain and then have to go to the consultation and then get it done. And then that's like such a long time. You're just going to be in such agonizing pain. Get it done when you can, you know? So yeah, I'm glad I got it done. So this is the same tooth. You've seen the other side. It was black and disgusting and rotting. And I'm somebody that takes care of my teeth. No, my teeth aren't perfect, but you know, I brush, I go to the dentist every 6 months. And that's what my wisdom tooth looked like. I guess after being partially under the skin and like all that stuff after 40 some years, that's what it looked like. And I think there might have been a filling put in it at one point. I don't know which side it might have been, but this is the tooth that was bothering me. The other side, when he took it out, he's like, this is the side that's decayed. This is the healthy side. And I don't know like which side it was that was in my mouth that was good and bad, but when it did hurt, like 40 some years never hurt, and then when it did, oh, it was bad. My regular dentist gave me like some special kind of rinse that you could only use for a certain amount of time. Thank God it went away, but then it never came back, and I feel like it would have come back, and when it would have come back, it would have come back with a vengeance, and then I would have been like, I wish I would have got it done sooner. So yeah, this is the healthy side. And I think he probably thought I was weird for wanting to take a picture, but can I please take a picture? And somebody asked me why I didn't ask to keep it. Yeah, I didn't want them because that would have been just disgusting bacteria, germs, just sitting somewhere where I live, and I didn't want that. But as you can see, here's a picture of both of them after they were out. And I really wondered, why was I fully awake and just got numb? Some people get put to sleep, and some people have like that slight sedation where they're not fully sleeping, but they're not fully awake. He said I had the easiest teeth, like it was like the easiest kind of tooth pull, so that's why I was awake. So that was my experience. Thank you so much for listening. Trust me, I didn't want to get it done, but if it's being recommended to you, there is probably a reason. Like I said, I know this is like super gross looking, but that's what they look like underneath. And I don't know if I mentioned this, but why I got the other one, because I just got the 2 lowers done. The other side never bothered me, but my regular dentist said that's probably inevitable. So when I went to the oral surgeon for the consultation, he agreed with that. So I just got both bottoms. My top ones are still in, so hopefully I never have an issue. I think they're under the gums though, so they don't suspect those being an issue. So yay, lucky me. That is my little story. I hope this this helped somebody. Thank you so much for listening. Hit that like button and subscribe.